Well, British Columbians have been struggling to find a family doctor for years now, but there are some signs that the situation might be improving, at least for some. Joining me now is our medical columnist, Dr. Melissa Lem. So, Dr. Lem, always good to have you here. So, how has the family doctor shortage evolved over the last few years?
I would say, Leanne, the overall evolution is in a positive direction. It's a good news story for BC, and a lot of it is because of the introduction of a new longitudinal family practice model, where doctors are now paid and valued for the time and effort they spend with patients, not just sheer numbers, and also expansion of primary care networks across the province have provided more collaborative care. So we have seen over 1,000 new family doctors join work in the province over the last couple of years, and over 750,000 patients are newly attached. So these are big numbers, but it's not the whole story. Attachment doesn't necessarily mean access. Sometimes patients still have to wait weeks to see their family doctor if they really want to see them in a timely fashion. And then sometimes the one issue per appointment model can reduce the overall comprehensiveness of care. So we do need, I would say, some changes systemically to make sure that everyone in BC has access to the primary care they deserve.
Right. So I was going to ask you about that, about demand. How's that looking? Are you still getting lots of calls? People like, please, can you take me on?
I would say yes. Okay. So, I do a mix of kind of covering my other colleagues' practices and then also my own practice. And almost every day I do have someone asking if I'm accepting new patients. And there are lots of doctors across the province who are accepting new patients right now.
So, I mean, you've talked about this before, but if someone was looking for a family doctor, what's the process at this point?
There are a number of different ways that you can try to get attached. One is really important to register in the Health Connect registry, where if you're unattached, the province will connect you with a family doctor or a nurse practitioner in your area once openings come up. Also looking on the College of Physicians and Surgeons of BC website, the Pathways BC website, and also the Divisions of Family Practice website in your area can connect you with different patient attachment initiatives. And then also just good old networking, asking family, friends, other healthcare providers you may know if they know of doctors accepting new patients, might just find you a new one.
I know lots of Facebook groups are very active every time they see a new doctor accepting patients. Now, can you talk a little bit about the difference between family doctors and nurse practitioners, and if that's a good option for most people?
Yes, 100%. So I will start by saying that nurse practitioners and family doctors provide very high levels of care within the province. Either is a great option. But the main difference is that family doctors receive over 10,000 more hours of clinical training than MPs, which means that they can typically handle more complex patients. On the other hand, nurse practitioners often have more time for their patients because of difference in payment models means they can provide more comprehensive care. So I do work in both rural and urban settings and have worked with a lot of excellent nurse practitioners that I would trust with my own care, who sometimes will refer patients to me if they are beyond their scope of practice. So it's really great to work with them collaboratively. And again, both are great options.
Both indeed, especially when there's still such demand, as you say, right? Okay, always great to chat. Thank you so much for your insight, as always. Dr. Melissa Lem, our medical columnist.
Thanks, Leanne.